I'm from Philips Research, and well, a big focus of our company is healthcare, and of course we are also very much involved in the trend towards personalized medicine. And in the P-Medicine, the personalized medicine project, we are leading the work package that focuses on clinical decision support tools. So the idea is to build tools based on the data that becomes available in the P-Medicine environment, but also using available knowledge out there, and the literature and models that were built by other people, and using that to support clinicians in well, efficiently choosing the best treatment for the patient. Well, of course, the knowledge available is quite disparate. So you really need to have access to a lot of data, to a lot of information, and that is currently not there. So the main thing is that, well, even for building models, you really need large data repositories, and this is one of the things that P-Medicine is trying to achieve. And well, then of course there is a lot of heterogeneity in what is available out there and in the knowledge that has been generated. So to integrate all that in a single tool is quite a bit of work. And another problem with clinical decision support is that you know, the information and knowledge becomes quite quickly obsolete. Which means that you really need to develop a system that can be easily updated, and it can really keep up with the evolution of knowledge in oncology, which is well changing very quickly. We would hope that it would save them time would enable them to focus on their main trade, which is actually treating the patients, instead of needing to look into a lot of data and a lot of information and a lot of systems, because currently in the hospital there are many systems and the information is present in bits and pieces in a lot of places, and they need to aggregate that in their head, and it takes a lot of time. So what we hope is that in the end they will get better treatments, or the treatments to which they will respond. But of course, clinical decision support in itself does not do new discoveries. So we actually rely on discoveries, and we actually we want to integrate the latest knowledge so that every patient out there has access to the latest knowledge, whether he or she is treated in a large university hospital or in a community center where, well, maybe the expertise is not that high. I mean, imagine that a patient has a rare disease, and he goes to a center where it's really the first patient with that disease in the last 10 years. It would be very nice to have a tool that would have access to really the latest knowledge, the latest models, and the clinicians could use those to really provide the best care that is available. So I think that P-Medicine is a very good place to do this type of work, because we have a lot of clinical expertise. So there are several large cancer groups that are involved. Also, there are people actually developing models based on data mining. And next to that, actually, we have access to large amounts of data. So the benefits of the P-Medicine data environment will be that not only will enable the CDS tools to use the new models that are developed on that data set, but also will enable us to revalidate those models when new data becomes available in the repository. So basically the models will be able to evolve and to be revalidated and extended when new data is available.